Attention Deficit Hyperactivity Disorder, abbreviated as ADHD. Subscribe, like, and share to receive notifications of new videos. During this presentation, we will cover the history, definition, characteristics, identification, prevalence, causes, educational considerations, and transition for ADHD. First, let's go back in time and look at the history. In 1773 to 1775, researcher Wakard was the first to publish about people with attention problems. Move up to 1798, and the researcher Crichton discovered that attention requires active effort, and that people can be born with or develop problems. In 1902, a researcher by the name of Steele coined the phrase defective moral control and discovered problems with inhibition. Skipping forward to 1936, the researcher Goldstein noticed soldiers were returning home with brain injuries and that there were issues with perseverance and distractibility. During the 1930s and 40s, researchers Warner and Strauss began to conduct background studies and coined the syndrome named Strauss syndrome, which related to hyperactivity and distractibility. In 1957, a researcher by the name of Cruikshank extended the work of Warner and Strauss with children who had normal intelligence and was the first to establish an educational program. During the 1950s and 60s, studies were conducted on minimal brain injury and hyperactive child syndrome. Minimal brain injury and hyperactive child syndrome were later called Attention Deficit Disorder, or ADD. In present day, we now call ADD Attention Deficit Hyperactivity Disorder, sometimes seen as Attention Deficit and/or Hyperactivity Disorder. Now let's look at the definition. Attention Deficit Hyperactivity Disorder, now referred to as ADHD throughout this presentation, is one of the most common neurodevelopmental disorders of childhood. It is usually first diagnosed in childhood and often lasts into adulthood. Children with ADHD may have trouble paying attention, controlling impulsive behaviors, or being overly active. Characteristics. A few characteristics associated with ADHD include impatience, constant motion, difficulty sitting still, constant talking, trouble completing tasks, inability to listen or follow directions when given instructions, boredom unless constantly entertained, interrupting other conversations, doing things without thinking or on impulse, and problems learning concepts and materials at school. Here are a few psychological and behavioral characteristics. There may be deficits in executive functioning or behavioral inhibition. There could be problems with adaptive behavior, social behavior problems, social rejection, or social isolation. Comorbidity is when there is more than one disability. People diagnosed with ADHD often have a learning disability. They may also have an emotional behavioral disorder, or they may fall victim to substance abuse. Research has identified 3 types of ADHD. The first type is predominantly hyperactive or impulsive. This is when a person has shown hyperactivity or impulsivity for at least 6 months. The next type is predominantly inattentive. This particular type of ADHD is when the person is not showing hyperactivity or impulsivity, but more inattention for at least 6 months. And the third type is combined with hyperactivity impulsive and inattentive. This person must have shown inattention, hyperactivity, or impulsivity together for at least 6 months. Because symptoms can change over time, the presentation may also change over time. Individuals displaying the hyperactivity and impulsivity type of ADHD may fidget, tap their hands or feet, they may squirm in their seat. They may leave their seat in situations when remaining in your seat is expected. Perhaps young children may run around or climb in situations where it's not appropriate, and adults or adolescents who are not running about or climbing may be limited to just feeling restless. Individuals may be unable to play or take part in leisure activities quietly. You may notice the person always seems like they're on the go, or as if they're driven by a motor. They may talk excessively. Perhaps they blurt out an answer before a question can even be completed. They may have trouble waiting for their turn. And finally, they may interrupt or intrude on others. Characteristics for individuals displaying an inattentive type of ADHD include: they may often fail to pay attention to details. They might make careless mistakes on schoolwork or other activities. They may have trouble holding attention on tasks or playing in activities. Maybe they don't seem like they're listening when they're being spoken to directly. And perhaps they may not follow through on instructions or fail to finish schoolwork, chores, duties in the workplace. They may have several hobbies that they've started but haven't finished. But basically, they're losing focus or they're sidetracked. A few other characteristics include: they may have trouble organizing tasks and activities, may avoid, dislike, or be reluctant to do tasks that require mental effort over a long period of time. Perhaps they lose things necessary for tasks and activities, such as school materials, wallet, keys, phone, eyeglasses, etc. Or they may just become easily distracted. And of course, they may be forgetful in daily activities. In addition to the characteristics previously described, other criteria is needed for an accurate diagnosis of ADHD. Several inattentive or hyperactive impulsive symptoms needed to be present before the age of 12. Several of the symptoms must have been present in 2 or more settings. A setting could be home, school, work, with friends or relatives, or during other activities. There also needs to be clear evidence that the symptoms interfere with or reduce the quality of social, school, or work functioning. Also, the symptoms do not happen only during the course of schizophrenia or any other psychotic disorder. There's also the criteria that the symptoms are not better explained by any other mental disorder, such as a mood disorder, anxiety disorder, dissociative disorder, or a personality disorder. That slide leads us into identification. Diagnosing ADHD is a several-step process. There is no single test to diagnose ADHD, and many other problems like anxiety, depression, and certain types of learning disabilities can have similar symptoms. The average age of ADHD diagnosis is 7 years old, but children with more severe ADHD may be diagnosed earlier. In order to be diagnosed, there are a few assessment measures. These measures include a medical examination by a professional or a doctor, clinical interviews with the parents and child, teacher and parent rating scales, and behavioral observations. Moving on to the prevalence. According to the DSM-5, or Diagnostic and Statistical Manual of Mental Disorders, approximately 5% of children have ADHD. ADHD is not recognized as a separate category of special education, but may be included under other health impairment or OHI and may get accommodations under Section 504. Boys outnumber girls at least 2 to 1. So what are some of the causes? The causes and risk factors for ADHD are unknown, but current research shows that genetics play an important role. Scientists are studying other possible causes and risk factors, including brain injury, environmental exposures such as lead, alcohol and tobacco use during pregnancy, premature delivery, and low birth weight. Research does not support ADHD being caused by watching too much television, eating too much sugar, social or environmental factors such as poverty or family chaos, or lack of parenting. These things might make symptoms worse, but the evidence is not strong enough to conclude that they're the main cause of ADHD. Let's look at a few educational considerations. In terms of treatment, ADHD cannot be cured, but it can be successfully managed. In most cases, ADHD is best treated with a combination of medication and behavior therapy. Good treatment plans will include close monitoring, follow-ups, and any changes needed along the way. Medication is used to treat ADHD because the chemicals dopamine and norepinephrine are involved with the diagnosis of ADHD. These chemicals regulate alertness, appetite, concentration, and endurance. There are 3 different types of medications prescribed depending on the type of ADHD the person has. The first type is a stimulant. It's the most commonly used drug. It allows children with ADHD to experience more calmness in day-to-day activities. But side effects could include stomach pain, irritability, decreased appetite, or insomnia. Regardless of these side effects, 70 to 80% of children with ADHD respond positively to stimulant medication. The next type is non-stimulant. It's either used in combination with a stimulant or as an alternative to them. There are fewer side effects, including stomach pain or headaches, irritability, and depression. The last type of medication is an antidepressant. It's less often used than stimulant or non-stimulant medication for ADHD, but it has been found to increase the risk of suicide in rare cases. If you'd rather not use medication for an ADHD diagnosis, there are a few non-medical treatments. These treatments include behavioral therapy, exercise and diet, and psychoeducation. Now remember, it is shown that a combination of medication and other treatments are the most effective way of treating ADHD. In terms of behavioral intervention for hyperactivity or impulsivity, you may want to consider creating a routine, helping the student get organized, avoid distractions, try to limit choices, which also helps with avoiding distractions, change your interactions with your child, use goals and rewards, try to discipline effectively, help the child to discover a talent so that they know what they're good at. A few accommodations that can be used in the classroom include preferential seating to avoid distractions and eliminate background noise, create shorter assignments to help the child be organized and maintain focus, closer supervision, clear instructions, help in getting started on assignments. You may want to use a timer, closer supervision of homework, frequent communication with parents and doctors, classroom structure, helping the child stay organized and keep a routine. Allow time for movement and more breaks. This helps with the hyperactive and impulsive nature of ADHD. Try to provide rewards and praise. This will help with behavior management. And also try to create an environment with fewer distractions during tests, such as a small group setting or a quiet classroom. Let's move on to transition. We want to make sure that our students are able to transition from elementary school to middle school, from middle school to high school, and from high school to the beyond. When you think about college, a person with ADHD may have more problems due to a lack of time management. Make sure you focus on time management skills, organization skills, and the importance of coaching. In terms of employment, make sure you try to help the student match their strengths and understand their weaknesses when they're choosing a job choice or a career. For marriage and family, there can be a negative impact due to the impulsive nature or the lack of attention that seems to be paid to others in the family. Thank you for watching this presentation on Attention Deficit Hyperactivity Disorder.